low milk fat syndrome. So with this, we can conclude this. This is also a common thing in the field conditions. And many of the farmers, irrespective of their producing, irrespective of their feeding management and all, they used to have a hefty animal purchase for 90,000 or 80,000 like that. But after getting the milk and all, no, when they are going and giving to the society, they are not getting enough money because it is not reaching fat percentage. So the payment will be made only according to the fat percentage. If there is low fat percentage below the level as the prescribed level, below that you cannot get the money for the produced milk. So it is economic important condition of this condition, low milk fat syndrome. So the main thing is the lack of roughages. So lack of roughage is one of the main thing, and lack of roughage and more feeding of concentrates. These two things are having predisposing cause. So many of the farmers, they would have, when conversation you could have get the history, they will be telling mostly the morning milk they are having low milk fat. Evening milk they will be having milk fat percentage a little bit higher than the morning milk. The reason is that there is a long interval between the afternoon milking and the morning milk. So afternoon they are milking, and the next they are milking in the early morning or the morning. So there is a prolonged interval. So naturally there is an increased quantity of the milk, increased yield of the milk will be there, but low in the fat percentage. So in morning milk, afternoon milk, the quantity of the milk will be somewhat less than the morning milk, but the fat percentage will be more when compared to the morning milk. Okay, this is the reason. So they used to say morning we are not getting the reading, morning we are not getting the fat percentage. That is the reason behind that. Then another one here, what you have to correct it, you have to correct the feeding management. So you should advise the farmer to have the split feeding. The carbohydrate should be splitted at some intervals, and you have to feed the carbohydrate. The split feeding of the carbohydrate should be advised, and you have to advise the farmer to give more roughages, especially paddy straw or any straw. Whenever the animal is having what is the reason behind that? The animal is fed with the paddy straw or any straw materials or roughages, the animal will start chewing. Whenever it is chewing, the animal will start secreting the saliva. When there is saliva secretion is there, the saliva act as a buffer mechanism in the rumen, and it will maintain the ruminal pH. That is one of the important reason behind the supplementation of roughages. And another one, when you give the straw, paddy straw, the animal will have more production of acetic acid. So acetic acid is produced more. So acetic acid is a precursor of milk fat percentage. So fat percentage will be increased. So supplement for paddy straw. Whenever in the summer conditions, the animal won't take a paddy straw or any other straw in the afternoon conditions, so that you can give it in the evening time, so that the animal will take more straw. So rumination should be that, chewing should be that. That will enhances the rumen buffer, so that the rumen pH is maintained and milk fat percentage is increased. Another one reason is subacute ruminal acidosis, SARA, subacute ruminal acidosis or acidosis condition. That also will lead to reduction in the milk fat percentage. All these things we have to keep it in mind and treat it accordingly. So one of the line of treatment is that they used to give vinegar, 5% glacial acetic acid orally, around 500 ml orally, that you can give, you can drench it to the animal. But one of the disadvantages is that it is an irritant. When you administer it orally, it is an irritation. It will irritate. The feed intake will be reduced. If you are having stomach tube, you can drench it. You can put the stomach tube and drench it. The another one is that only when you are giving vinegar today, I mean, if you are giving tonight, tomorrow morning you will be getting the fat percentage. Again, the fat percentage will be reduced if you are not giving this. And practically, you cannot give this vinegar daily. So it is a not economical one also. So daily feeding the vinegar is not a permanent solution. So for that, you have to correct the feeding management. So split the concentrate feeding, feed more roughages, and supplement rumen buffer mechanisms like magnesium oxide and the commercially available things you can give. And magnesium oxide can be given, or magnesium carbonate also can be given. Magnesium oxide can be mixed with the feed and you can give it to the animal. So 1 gram per kg body weight. Magnesium oxide can be given at the rate of 1 gram per kg body weight. You can mix it with the feed and you can give it. And it will maintain the ruminal pH, so that you can correct it and you can increase the milk fat percentage. So these are all the common practical things to increase the milk fat percentage. I hope we have completed all the metabolic conditions, right from ketosis to metabolic in the low milk fat syndrome. So thank you very much, and go for a discussion.